Welcome, Minister. We're very grateful for you to be with us tonight. Jillian Skinner is our special guest, and it's with great pleasure that I now invite her to perhaps say a few words to you. Thank you very much.
Thank you very much indeed. It's a pleasure to be here despite the rain and the accidents en route, but I'm glad that I made it when my husband's still parking the car somewhere. Bruce, I want to acknowledge you, Chairman of Kids of Macarthur Health Foundation. I want to acknowledge my parliamentary colleagues from the State Parliament, Brian Doyle, member for Campbelltown, Chris Patterson, member for Camden, Jai Rao, member for Wallandilly, and the Shadow Health spokesman, member for Macquarie Fields, Andrew McDonald. I know you're here somewhere, Andrew. My federal parliamentary colleagues, members of various councils, distinguished guests, ladies and gentlemen, it really is a very great pleasure to be here. I know from my colleagues that the Kids of Macarthur Health Foundation is a truly wonderful example of the work and commitment of local businesses and the local community here to the people of the Macarthur area. Through the work and efforts of this group, significant funding has been provided over the years for the purchase of essential equipment for children's services, directly assisting local families and their children. The Macarthur region is a growth area, and the population is projected to grow by 53% up to 2021, compared to 17% for the rest of New South Wales. Many years ago, when I was working as a journalist, I actually did some work for the then state government on Macarthur, the growth centre. I used to come out here and it was just a shadow of what it is now. And it's projected to grow much more. From a health perspective, we've developed a clinical services plan for the area, and it will mean that Campbelltown Hospital will become a principal tertiary referral hospital in the future. This will meet local demand. As a result of the clinical services plan, the plan to implement it was developed to identify where service expansion and growth would be. And from that growth and from that clinical services plan, the New South Wales Government, I was very pleased to be here with my parliamentary colleagues last year to announce that we committed $139 million for the expansion of Campbelltown Hospital. This will include 90 new beds, 4 new birthing suites, 2 new interventional suites, an expanded outpatient and ambulatory services floor, an expanded emergency department with specialty paediatric emergency area, a mental health business case for 70 new adult inpatient beds. The early works for the redevelopment of the hospital have begun, and this involves the relocation and expansion of car parks, the relocation of the helipad to an adjacent site near the new acute building, and the expansion of the loading dock and enhancement of essential in-ground services such as water and electricity. So even though you don't see much work happening now, these are essential works preparatory to the redevelopment and expansion of the hospital. And while this expansion of the hospital occurs, of course, the work of Kids of Macarthur Health Foundation continues. I'm told that this year's fundraising efforts will focus on the establishment of the sensory room at Guy Carr Looney, also located at the hospital. This sensory room will allow young people to self-soothe and regulate their emotions through the use of sensory stimuli and equipment. I visited one of these for the best possible outcomes during inpatient and after discharge from the hospital. During my first visit, I was Shadow Minister for 16 years, so I have actually visited Campbelltown very many times, most frequently during the election campaign before we were elected, standing outside with my colleagues, 3 to 4 mentioned members of the government. But during my first visit to the hospital after becoming the Minister, and it was one of the first hospitals I visited, I met with the Medical Staff Council and I was particularly impressed by a number of clinical services provided by the hospital, among them paediatric care. This is one of the reasons why I have established Kids and Families New South Wales, to develop a strategic platform for the delivery of health care to children, to young people and their families across New South Wales. And it's one of the reasons why I'm happy to pledge towards your fundraising effort tonight $25,000 on behalf of the in your achievements for fundraising. Congratulate you on what you've done today. I think it's absolutely stunning that you've raised so much money, and I look forward to sharing future achievements as the expansion of Macarthur Hospital proceeds. And thank you very much for having me.
Ladies and gentlemen, we once again thank the Minister for being with us tonight.